Eldoret, Uasin Gishu County, where our correspondent there, John Wanyama, is about to speak to K.M.P.D.O officials about the ongoing lecturer strike, which has entered its second month. We should be on the 40th day today. John Wanyama, let's get their views on this lecturers' pay dispute.
Yes, Maura, and K.M.P.D.O officials are saying that the situation is very worsening in Moi Teaching and Referral Hospital. And this, if the trend continue like this, they are worried that things may get out of hand, and they are asking and calling on those people involved in this matter to come in quickly so that they can resolve this issue once and for all, so that medication in our second largest hospital, Moi Teaching and Referral Hospital, can resume as normal. I'm talking to K.M.P.D.O official, Dr. Mogeni. Daktari, I know your area of specialization is in you are a gynecologist, and maybe what is this? How are you now managing to run this where you are?
Thank you very much. It's been a very difficult situation, and such situations are not what we normally anticipate, because initially when there are labor-related conflicts, our hope is that they will take a short period and within no time they are resolved. But when they take long, it takes a life of its own course. The stopgap measures which are usually put in place, they become now an issue, and patients suffer. We have got emergence kind of ways we are trying to handle our patients, but everything cannot be emergence. We hope that a long-term solution should be reached as soon as possible, so that our patients are attended in the very best way. Remember that MTRH coexists with Moi University, and there is a memorandum of understanding on service delivery and on how patients are attended to. So we co-share the human resource that we have. That's the doctors in training and the doctors who teach them, the lecturers who are also on strike. We didn't anticipate that this issue will take this long, and it is an embarrassment to the nation, because at the moment we are talking about universal health coverage, and access cannot be an issue when we have plenty of it, just because people cannot sit down and talk.
Okay. Doctor, maybe if you can paint for us the picture in Moi Teaching and Referral Hospital. How is the situation, and how many doctors are now on strike in MTRH?
You see, the government doctors are the ones specifically who work for Moi Teaching and Referral Hospital are just like half the number of doctors who usually serve the department. Now, if we're dealing with half the population, then the services have to be even half. But it is worse because the doctors in training also have got a huge contribution, because you see, it is through teaching that sometimes they render services. If we do not solve the issues quickly and they get back to work, it brings a big issue. Then it requires that the government employs much more doctors, and yet these are the doctors who we are delaying. They are going out of school. The government wants to get specialists from Cuba. It's quite ironical that you are looking for specialists, but you are not ready to churn out specialists in a quick way by not solving some immediate issues which are arising and which can be solved very quickly. Yeah.
Thank you, Dr. Richard. Wahiga, if you can give me 1 minute, I talked to Dr. Daisy Korir. Dr. I understand we talked yesterday a bit. If you can face the camera, maybe how is this strike maybe dragging down our students who are supposed to graduate any time from now?
Thank you very much, Wanyama. I think, like we've been saying every other time, whenever we have a conflict, then we should move in quickly to try and resolve it. And right now, as we speak, we were having a training on conflict resolution sponsored by the Moi Teaching and Referral Hospital, and we would wish that the university and the government embrace conflict resolution mechanisms that will avoid this kind of industrial actions, because as we speak now, we are having a lot of delays in terms of the training that we are offering. The medical students, both undergraduate and postgraduate, have delayed to graduate. The undergraduate were to graduate in May, and the postgraduates were to finish in March. and this has now delayed, and we realize that the whole country right now we do not have any doctors who are in training offering services, because these doctors are the ones that the main hospitals, that is the Moi Teaching and Referral Hospital and the Kenyatta National Hospital, relies a lot on intern doctors and specialist doctors who are on training to offer the day-to-day services. So yes, the specialists are there, but they are there only to guide and help the trainees to offer the services. So when this strike is going on right now, the specialist doctors in training cannot offer any form of service without supervision, and as a result, then it means the many numbers of patients who come to Kenyatta and Moi Teaching and Referral Hospital are not able to be served on time. Some are being booked longer than necessary, even up to 6 months, to come and be seen maybe in a clinic. And even those ones who are waiting for operations, they have to take longer, because now the people who are operating are fewer than what they were before. So the other thing is that you realize we are waiting for these specialists very desperately, because our country has a very low number of specialists compared to the patients. And so when we delay to graduate them even by a year, remember last year we had another strike that caused another delay of up to 6 months, because these people are supposed to graduate in September, but now they were meant to graduate in March. That's another 6 months delay. So when we have such a delay, then we deny the counties, especially the far-flung counties who are far from Nairobi and Eldoret, we deny them the very much needed specialist services that they require at the moment, and therefore we are still overburdening the same 2 national referral hospitals, which are at the same time not having enough people working there. So I think this is an issue that needs to be sorted out very quickly. The medical schools should sit down with the Ministry of Education and Treasury and have the money that was negotiated for these doctors to be released and paid.
Okay. Maybe this impact will be felt maybe for how long? 2 years, 3 years from now?
So like I told you, we've already missed a graduation last year. That means last year September and maybe December we missed to graduate specialists and also the young doctors. And if we don't graduate them now this September because of this new strike, then that means we've lost a total of 2 years. And to fill in the gaps that could have been filled in by the doctors coming in for 2 years will take us another 4 or 5 years, because remember, training for medical doctors takes 6 years in undergraduate, then 1 year of internship, and another 4 to 6 years in postgraduate. So if you lose 2 years of not producing new specialists, then you've put a very big setback in our aim to try and achieve the WHO recommendations of the doctor-to-patient ratio, and therefore even our aims to achieve the universal health care are being hampered by this strike. Yeah.
Thank you very much, Maura. Those are worrying statistics from these K.M.P.D.O officials from here in Uasin Gishu County, but these are national K.M.P.D.O officials. So Wahiga, we are still following up on these issues. I hope the MTRH management will be also allowing us to go inside the hospital so that we can check on what they are doing, because we have heard that more doctors are overworking with a lot of overworking for more longer time, and we want just to go there to see what the patients are going through, so that we can also come to you and our viewers, so that we can inform you what is really happening in Moi Teaching and Referral Hospital, the second largest hospital in the country.